What I'm going to focus and spend a little bit more time on is the condition known as craniosynostosis. And craniosynostosis is basically where there is premature fusion of the sutures in the head. And what happens is the head gets very misshapen. It can be shrunken, it can be egg shaped, it can be flat, it can be flat on the sides, you know. So, not only are there cosmetic issues, but the bigger issue is that these sutures closing with the fontanelle closing means that you've got a fixed brain space so that the brain cannot grow effectively as the child grows. And so you've got the risk of severe intellectual delay, obstructive hydrocephalus, and raised intracranial pressure. So, in terms of craniosynostosis surgery, what does the surgeon do? Well, basically, it is a cosmetic correction and prevention of neurological complications. And the child's scalp is reflected back. The bones are removed of the skull. The sutures are broken open, and the bone is placed with space in between it in the correct shape on a sort of framework, a mesh kind of framework that the bone is screwed onto. And that normal shape with then spaces between the bones allows the head and the brain to grow to normal size, and then those sutures fuse at a normal age and allow normal head development, as we said, both for cosmetic and neurological purposes. The biggest issue with these surgeries is that these patients bleed. If you imagine scalping an entire skull of a child, the blood loss can be spectacular. It's ideally performed also before 12 months of age. So you've got a small child with limited physiological reserve, but the earlier we intervene, the earlier we can ensure optimal neurological outcomes and optimal cosmetic outcomes. The biggest anesthetic considerations, as I've said here, is that we need to be aware of the risk of catastrophic bleeding, rapid bleeding, and the entire head and neck of the child is exposed for the entire surgery. Where do infants lose all of their heat from? Their heads. So they get cold. So you need to have invasive lines, you need to have multiple IV lines, you need to have a warm fluid, warm blanket, warm theatre, all of those things. And you need to keep up with fluid loss meticulously. You need a surgeon who uses good diathermy technique, bone wax, all of those things, and who is as quick as possible. And the goals, as we've said, are to, from an anesthetic point of view, maintain hemodynamic stability, maintain neurological function with brain perfusion, make sure you don't get any spikes in intracranial pressure, prevent any seizures, etc. And for the surgeons, you want to get optimal cosmetic and neurological outcomes by ensuring a normal head size and normal growth of the child's head. So they can be very challenging surgeries, but I love being a part of them because they're incredibly rewarding.